Gentlemen, let's talk about a topic many of us, especially after 60, might shy away from discussing openly. Masturbation. It's a completely natural, healthy part of human sexuality. And for many men in their later years, it continues to be really important for both physical and emotional well-being. But here's what I've seen in my practice. After 60, certain habits, certain ways of doing things can actually lead to discomfort or even some potential health issues down the road. Today, as a urologist, I'm going to reveal exactly how to masturbate safely after 60. And more importantly, we're going to dive into the 3 big mistakes I constantly see men make that you absolutely, without a doubt, need to avoid. This isn't just about pleasure, mind you. It's genuinely about your prostate comfort, over your all well-being, and making sure you maintain a healthy, fulfilling sexual life for years and years to come. So, stick with me on Men's Health Channel. This is crucial. Just a quick note, this video is for educational purposes and isn't a substitute for personal medical advice. Always check with your doctor about your individual health needs. Welcome back. In all my years as a urologist, one thing has become abundantly clear. Addressing all aspects of men's health, even the most personal ones, is absolutely vital. Masturbation is just that, a normal human behavior that transcends age. For older men, it can be beneficial in various ways. Some studies suggest regular ejaculation may help with pelvic comfort and fluid turnover in the prostate, though the evidence on preventing prostate disease is mixed. It's also a fantastic way to relieve stress. But here's the nuance. Our bodies do change with age. Tissues get drier, sensation changes, and certain habits that once worked perfectly may now cause discomfort. So, while the act itself remains beneficial, how you engage in it becomes incredibly important for your long-term comfort and, frankly, your overall health. That's why today we're going to tackle those specific pitfalls directly. Let's jump right into the first big mistake I observe. Mistake number 1, and this is probably the most common oversight, especially for us after 60, not using enough or perhaps not even the right kind of lubrication. You see, as we age, our natural lubrication, well, it can definitely decrease. When you're engaging in any kind of friction without adequate glide, you're not just creating immediate discomfort, you're actually increasing the risk of micro-injuries to sensitive penile tissue. And in some cases, tissue injury has been associated with conditions like Peyronie's disease, which can cause painful curvature. So, the safe alternative here is straightforward. Make it a habit to use a high-quality lubricant. Water-based lubricants are safe and easy to clean. Silicone-based lubricants last longer and are great if you have drier skin or longer sessions. Just be mindful they aren't compatible with silicone sex toys. And remember, oil-based lubricants should never be used with latex condoms as they can degrade the material. Apply generously and don't hesitate to reapply as often as you need to. Think of it as truly protecting your most sensitive areas. Now, let's move right into the second mistake. This one honestly often goes hand in hand with the first. Mistake number 2. Using excessive force or an overly aggressive technique. Many men, develop habits from their younger years where applying more pressure seemed to lead to more sensation. But after 60, that approach frankly becomes counterproductive and potentially quite harmful. Overly vigorous movements, squeezing too hard, or even bending can put immense undue stress on those delicate erectile tissues, the tiny blood vessels, and your crucial nerves. This isn't just theory. It can genuinely lead to bruising, a lingering numbness, or even long-term damage. And ironically, that very approach can actually reduce sensation. My advice for the safe alternative is to really focus on gentle, rhythmic motions. Take the time to explore different techniques that truly prioritize sensation and comfort over just sheer force. Think slow, steady, and mindful. It's about feeling the pleasure, letting it unfold naturally, not forcing it. And please listen to your body. If anything hurts, if it feels off, just stop immediately. And finally, we come to the third mistake. This is one that many men honestly don't even consider, but it's incredibly important. Mistake number 3, neglecting proper hygiene immediately after ejaculation. While this might seem minor, it is crucial for preventing infections, especially for men who might already have underlying conditions like an enlarged prostate or diabetes, which can make you more susceptible to issues. Leaving residual fluids. Well, it can quite literally create a breeding ground for bacteria, potentially leading to urinary tract infections, skin irritation, or lingering discomfort. The safe alternative here is both simple and highly effective. Always wash your penis and the surrounding area with warm water. If you choose to use a cleanser, pick a pH-balanced, fragrance-free option designed for sensitive skin. Avoid harsh soaps and make sure you dry thoroughly. This simple routine goes a long way in maintaining skin health and significantly reduces your risk of any irritation or infection. It's just good self-care. So, why is being so incredibly mindful about these practices so vital, especially as we step past 60? It's not just about avoiding immediate pain, as important as that is. It's truly about preserving your long-term sexual health and your comfort. When you treat your body with the care it deserves, especially those delicate tissues, you actively contribute to better blood flow, healthier nerve function, and a significantly reduced risk of injury or infection. It's an investment in your well-being. Gentlemen, remember these key takeaways. 1. Listen to your body. Any pain, discomfort, or unusual sensations are really just your body sending you clear signals. Don't ignore them. 2. Be open to exploring new sensations. As we age, what feels good can definitely shift. Be willing to adapt your technique. Try new approaches. 3. Frequency is personal. There's no right or wrong amount. Do what feels comfortable, healthy, and fulfilling for you. And finally, hygiene is essential both before and especially after. It's such a simple step, but it brings big, big benefits. Now, a critical absolute non-negotiable point. While all these tips are here to promote safe practices, they are by no means a substitute for professional medical advice. If you ever experience persistent pain, any bleeding, unusual discharge, significant and concerning changes in sensation, persistent difficulty achieving or maintaining an erection, or any other symptom that simply concerns you, you must consult with your personal doctor or a urologist immediately. Early detection and timely treatment are always your best course of action. Remember, gentlemen, masturbation is a perfectly normal and healthy part of life. By truly understanding these common mistakes and consciously adopting safer, more mindful practices, you are genuinely empowering yourself to maintain a comfortable, fulfilling, and a very healthy sexual life well into your later years. It's about taking proactive charge of your self-awareness and ultimately your self-care. Ready to take even more proactive steps for your men's health? Here's how you can keep this momentum going. Hit that like button right now. Subscribe to Senior Support 365 channel and Senior turn on the bell so you never miss practical science-based tips for men's health after 60. Drop your questions or comments below. I might even answer them in the next video. Thank you so much for watching today. See you in the next video.